So Atomic looked at stage 3 colon cancer and evaluated the addition of atezolizumab, an anti-PD-L1 antibody, to FOLFOX chemotherapy, comparing to standard FOLFOX alone. And we demonstrated that there's a 50% reduction in recurrence or death with the addition of immunotherapy to chemotherapy when we look at our 3-year disease-free survival data. So it's a very clinically impactful finding that will be practice-changing in the United States and throughout the world. We regard it as a new standard of care for the treatment of these patients. So we actually saw that there was a divergence in the survival curves that occurred quite early, and then in the atezolizumab-containing arm, there was a plateau of the survival curve, which we always are impressed with because it indicates there's fewer events occurring in that arm of the study. We had a hazard ratio of 0.5 with a highly significant p-value of 0.0001. So we have great confidence in the results. In addition to that, there was retrospective central confirmation of the deficient messenger repair status of the tumors. And when we look at those data, it's nearly identical in terms of the outcome, so highly confirmatory of our result where it was done with local testing.